Welcome to the Fascia-Informed Therapist, the essential podcast for occupational therapy professionals looking to deepen their understanding of fascia's pivotal role in therapy and health. I'm your host, Amy Mayer, an experienced occupational therapist, practice owner, and dedicated educator. Here we'll dive into the fascinating world of fascia, exploring its significance in the human body and its critical influence on occupational therapy practice. Each episode will bring you cutting-edge insights, expert interviews, and practical strategies to help you confidently integrate the science of fascia into your therapeutic approach. Whether you're a seasoned practitioner or just starting out, our goal is to equip you with high-quality, evidence-based, and fascia-informed continuing education opportunities that will enhance your skills and benefit your clients. So join us as we unravel the complexities of fascia and transform the way you practice occupational therapy. All health and wellness practitioners are welcome. Let's learn, grow, and evolve together. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. Today we're going to do a little thought experiment. We're going to pretend the same thing happened to all the other body systems that happen to fascia. We're going to take them one at a time. We're not going to go through all the body systems because you're going to get the point pretty quickly, so this will probably be a short one. So let's pretend that, let's take the muscular system. That's a system that we pay a lot of attention to, right? So let's pretend that when you were in your anatomy class a while back, well, at least it was a while back for me, so for some of you it might be fairly recently. But let's pretend you're in your anatomy class, or maybe you're in your dissection lab and you see these things in the body, or you see pictures of them on the screen, and the instructor says, yes, those are muscles, but those are not important. We're going to move along here to the other structures and tissues in the body that you need to know about and understand in order to do the job that you came here to learn to do. And then you move through your curriculum and you're taught how to assess the body, and you're taught how to take that information and integrate that into your thought process so that you can appropriately treat the person. You integrate all the information about all the other body systems that you know into your thought process so that you can create a safe and effective treatment plan for your client. So you don't know anything about the muscular system, and then let's fast forward 20 years, maybe 30, and you've gotten really comfortable treating the human body the way that you've been treating it with the knowledge that you have. You trusted in your educational system. You've trusted in the continuing education that you've received so far. And then suddenly someone's saying, oh, wait a second. We can treat that. That system is so much more than we thought it was. It actually helps with movement. It actually helps maintain posture and body position. The muscular systems helps to generate heat in our body so that we can stay warm. It helps to stabilize our joint. It assists in circulation. It helps with metabolizing all the important nutrients in our body. There's so much that this system does. How would you react to that? It's hard to do that thought experiment because we already know all that information. But if it was stripped away, how much would that strip away of the interventions that we do and choose? It's almost even hard to conceive of, right? Same thing with the nervous system. Well, we can kind of take that particular system when we think about everything we've learned about the brain in the last decade or two. That's massive. And with what we've learned about the brain in the last couple decades, that has generated so much innovation in so many different disciplines, but most definitely in OT and the disciplines we work the most closely with. That has massively changed what we do with our clients. It massively changes the information we collect and that we want to know about our patient. So when we think about the body that way, we have learned a ton about the nervous system. We have learned a ton about the digestive system and gut health and how that functions and how that influences health and wellness. And maybe that's not an area that directly affects the profession of occupational therapy that closely. It does, and I think it's going to continue to do that, and we need to pay attention to gut health because that influences everything else. So the point I'm trying to make here is that's what's happened with the fascial system. We were taught that it wasn't important, and that was, and yes, I totally trusted my education, both my master's in OT and my doctorate in OT. Never heard boo about it, except it's not important back in my master's training. Totally trusted the CE I've been to, but it's not their fault. Unless you are specifically looking for this information, you're not going to find it up until now. But it's coming out from a lot of different directions now, and we need to pay attention. I think if we look at our ethical standards, we need to stay informed. We need to not just complete our CE, we need to develop ourselves professionally so that we stay up to date so that we can do the best possible work for our clients. And that's what I'm trying to do, is I'm trying to speed this process, at least for my profession and any other profession that will listen. But I hope you really spend some time thinking about that thought experiment. And if we apply that same thinking again to the fascial system, and you learn about all the amazing things that it is involved with in the human body, proprioception, interoception, movement, support, immune system function, communication inside the body. Imagine the innovation that's going to happen in the next 10 to 20 years. It's already happening in the sports world. High-level sports is going crazy with this. They're learning how to improve function and treat injuries and heal faster. That is exactly what we want for our patients. So spend some time thinking about that little thought experiment, and I hope you will, at minimum, get on our email list. At this particular time of recording this, we're rolling out some new features that will be tacked on to our big fascia science course. We're also adding an online community that anybody who's taken any of our courses can join. We're also adding a membership, and you get several months free if you enroll yourself in the fascia science course. You get 4 months of an online group mentoring experience for free. And then anybody who enrolls themselves in any other of our courses can join that membership and be part of that. And then we're also adding one-on-one coaching for you real go-getters out there who really are creating and innovating and want to integrate all this amazing science into your practice. So I hope you'll go there and check all that out. Minimum, get on the email list. Next step is go and check out those courses because I want to keep this profession on the edge. Thank you and have a wonderful day. Thank you for tuning in to the Fascia-Informed Therapist. It's been a pleasure sharing insights and strategies to help you integrate fascia science into your practice. I'm Amy Mayer, and I hope today's episode has inspired you to explore further and take your therapeutic skills to the next level. Remember, we're committed to creating and providing top-notch, evidence-based, fascia-informed continuing education that empowers you as an occupational therapy practitioner Stay connected with us for more enriching content, and don't forget to check out our online courses to deepen your expertise. Until next time, keep expanding your knowledge, refining your skills, and confidently applying the science of fascia to your practice. Here's to advancing together in health and wellness.